Colon cancer is the third most common cancer globally and the second leading cause of cancer-related deaths. In recent years, there's been a concerning rise in colon cancer cases in young adults. While it was once considered a disease affecting older individuals, more and more people under the age of 50 are being diagnosed. In fact, the American Cancer Society reports that people born in 1990 have twice the risk of colon cancer and 4 times the risk of rectal cancer compared to those born in 1950. I'm Dr. Katina Richardson, a board-certified family medicine doctor based out of South Florida. In this video, we're going to discuss the top 5 warning signs of colon cancer, when you should be screened for early detection, and lastly, we're going to go over how we can reduce our risk of developing colon cancer. Starting with number 1, we have persistent changes in your bowel habits. This includes diarrhea, constipation, or a change in the consistency of your stool that lasts longer than a few weeks. For example, if you normally have regular bowel movements, but then suddenly start experiencing frequent diarrhea or more episodes of constipation without any apparent cause, it's time to talk to your doctor. Keep in mind, these symptoms could also be related to other diseases like dietary changes or irritable bowel syndrome. However, it's still important to not dismiss them. The second warning sign of colon cancer is blood in your stool. This can be bright red or extremely dark. You might notice it when you wipe, or you might notice it mixed in with the stool. While this also could be caused due to hemorrhoids or anal fissures, again, it's still worth it to have a conversation with your doctor to rule out serious causes like colon cancer. The third warning sign is unexplained weight loss. If you find that you're starting to lose weight without making any significant changes to your diet or your exercise regimen, this could be a sign that your body is using a lot of extra energy to fight something serious. The fourth warning sign of colon cancer is persistent abdominal discomfort. This can range from cramps and pain to gas and bloating. Let's say you have a nagging discomfort in your lower abdomen that just doesn't go away, even after passing gas or using the restroom. It could be a chance that's more than just indigestion or a stomach bug. Although other conditions such as diverticulitis or gastroenteritis can present with very similar symptoms, it's important to have a thorough evaluation or at least a talk with your doctor to make sure it's not colon cancer. And finally, our fifth warning sign is weakness or fatigue. Colon cancer can cause chronic fatigue due to internal blood loss or other metabolic effects. If you find yourself feeling unusually weak or tired, even after having a really good night's rest, and it's affecting your daily activities, then it's time to talk to your doctor. And fatigue, like many of the other things that we mentioned, can be caused by several other things. The point is, if it's persistent, don't ignore it. While these warning signs are crucial to recognize, it's equally important to have a primary care doctor or a doctor that you trust. Having a doctor that knows your health history and with whom you feel comfortable discussing sensitive issues is invaluable. Your doctor can help you navigate any changes that you're feeling in your body and ensure that you get the right screenings and the right tests. So in terms of screenings, for most people, screening should start at age 45. However, if you have a family history of colon cancer or other risk factors like inflammatory bowel disease, your doctor will recommend you screen earlier. For instance, if you have a family history of colon cancer, particularly in a first-degree relative, which means a sibling or a parent, you may start your screenings at age 40 or 10 years prior to the age the relative was diagnosed with colon cancer. For instance, if your relative was diagnosed with colon cancer at age 40, you would start your screenings at age 30. And you may also require more frequent screenings. And the reason screenings are so important is because screening can detect colon cancer very early when it's most treatable. And in some cases, it can prevent cancer by allowing doctors to remove precancerous polyps. In terms of preventing colon cancer, lifestyle is still king. A healthy diet is one of the most powerful tools that you have to prevent colon cancer. So in general, we should really increase our fruits and our vegetables. They're packed with fiber, vitamins, and antioxidants that can help protect against cancer. We also want to really increase our whole grains. This includes foods like brown rice, oatmeal, and whole wheat bread, which are also very rich in fiber and support a very healthy digestive system. You want to limit your red meat and your processed meats, as these have been linked to a higher risk of colon cancer. You also want to limit your alcohol and your sugary drink, as both contribute to obesity, which is also a known risk factor. And in addition to diet, regular physical activity, not smoking, and maintaining a healthy weight are all crucial steps in reducing your risk. So knowing the warning signs, getting regular screenings, and making healthy lifestyle choices can make a significant difference. But most importantly, listen to your body. If something feels off, don't ignore it. Talk to your doctor, ask questions. Don't be afraid to ask questions. And if you don't have a primary care doctor, now is the time to get one.